Soon you'll be able to shop for health insurance like you shop for a new TV. At least that's the goal behind a state initiative. This day marks the first anniversary of the massive health reform law. In tonight's segment 2 News reporter Marla Carter shows us that some of what's in the plan has been part of Oklahoma's mission for years.
Were we that busy?
We were that busy.
Business is good for Scott Treza. He's one of the owners of this bagel shop. But as a small business, there are challenges like providing health insurance. It's a perk they can't afford to do.
There you go.
In fact, Treza doesn't even have health insurance himself.
I'm healthy, and so I just pay the doctor when I'm there, and it saves me money that way.
He says he's been to the doctor twice in 20 years. Treza's story isn't uncommon. Many Americans opt not to have health insurance, but a new initiative is working to change that.
You can have access to affordable, high-quality health insurance for you and your family.
The idea? In about a year and a half, you'll be able to go online and see a list of all the different policies you can get. Think of it as a marketplace of sorts, where insurance is for sale.
You can go online, you would be able to see what is available, you'd be able to see what those options are, you'd be able to see what the coverage was, you'd be able to see what the cost was, and you would be able to compare that with other plans.
It's something the state's been working on since President George W. Bush's administration. In fact, Oklahoma is so ahead of the game, it was one of 7 states that received federal grants to create the insurance marketplace.
We're not being forced to do this, we're not following the pack. We are actually leaders in this field.
While Oklahoma was already working on the project, the health care reform that passed last year requires states to come up with their own marketplace of sorts, or the feds will come in and do it for them.
If we don't do that, then there will be some controls that will be implemented for us.
As a businessman, Treza says competition is a good thing.
I like where I can pick the items that I think would benefit me the most, and I would be willing to pay that for, insurance against something catastrophic.
Plus, he says it gives his employees choices, too.
They can shop, and they can go, and it's theirs. They own it. They maintain it.
After 20 years of not having insurance, this new marketplace has a new customer.
I'll shop around. I most definitely will, yes.
Marla Carter, 2 News works for you.
Marla, thanks. Now, the state of Oklahoma is suing the federal government over parts of its mandated health care reform. Officials say that the health insurance exchange that the state is working on should factor into it.